Hi, we're going to talk about orthotics today, and in particular the cam boot. This is worn anytime you are going to be weight bearing. And orthotics, like the cam boot, can help with stability and immobilize that joint to help protect it and promote healing. I'm going to show you how to put this boot on. It's pretty simple. The main thing you want to be aware of is you just want to make sure that your skin is never up against the plastic of the boot. It provides a lot of padding, and of course your own clothing will help too. You can see that it has a lot of straps and buckles, and so you want to make sure those are never touching your skin, and there's no need to. There's plenty of padding that can go on your skin first, as you see me doing here, and then the buckle and the straps will go on the other side of that padding. You want to make sure it's a good fit. If there's a lot of movement, if your foot and leg is moving around a lot inside that boot, that's when you're going to get those skin irritations and sores, blisters possibly, and we don't want that. So you can see it's pretty easy. You know, you're just taking that strap, you're putting it through the buckle, just like a belt buckle, and then you're pulling it back the other direction and securing that Velcro. You're going to take the boot off in the opposite way. Double check all those straps. And now when you go to put weight on that leg, you want to check to make sure your heel is in the back of the boot. And there you have it. These are used, post-injury, post-operation recovery. And to take care of your boot, you can remove all those padding. Those are just Velcroed in. And I would advise you to use a damp cloth with some mild soap. I would avoid completely submerging those pieces. It would just take longer for them to dry. Make sure you rinse out those pieces really well. Lay them out to dry. I always like to use the towel as a last measure to squeeze out even more water. What you see me doing here is something I want you to do every time you remove your orthotic. You're checking your skin. You're looking for redness. You're checking for blisters, any skin irritation, because sometimes we're not aware of it. And sometimes because of operations and injuries, our sensation isn't normal. And that leads me to, of course, any reasons that you should call me about would be things like sensation changes. If you are noticing that you have some new numbness or that you have a new sharp pain that has developed, I need to know that. So that would be something I would like you to call me about. I wanted to mention what you just saw me doing there was I was checking my straps, my buckles, checking the bottom of the boot. You're going to be wearing this all over the place. So making sure nothing's on the bottom. Thank you.